Leukemia Care at Memorial is built on hope and science. Our specialists combine the latest treatment protocols with individualized attention, helping patients regain health and strength.
Hello everyone, I'm speaking to you from Memorial Bahçelievler Hospital. I am Professor Dr. Emre Tekgündüz. I'm the director of the Adult Hematology and Stem Cell Transplant Unit. Today I'd like to share some brief information with you specifically about leukemia. As you know, leukemia is a stem cell disease, a bone marrow disease that our people are quite afraid of and that we all worry about. We broadly classify them into two groups. In chronic leukemias, specifically CML and CLL, with the proper use of rational treatments, it is now possible for our patients to overcome this disease without the need for hospitalization, while carrying out their normal activities in a completely regular environment. As of 2025, a lifespan compatible with gender and age is now within our reach. The other issue is acute leukemias, which is a somewhat more challenging problem. Patients really do need to be hospitalized for long periods. On one hand, we have AML, which we see more frequently, especially in the adult age group, and on the other hand, ALL, that is acute lymphoblastic leukemia. Our patients may present with low blood counts without any complaints, or sometimes with swelling in the lymph nodes, bone pain, enlargement of the liver and spleen, and depending on the affected area, sometimes with neurological symptoms due to central nervous system involvement. They may also present with bleeding problems. In both of these serious diseases, after first evaluating the patient's blood values for diagnosis, we then examine the morphology of the cells with a peripheral blood smear. Afterwards, we perform a bone marrow biopsy to make a definitive diagnosis. One of the most important points here is not to look at the patients themselves, but to examine the molecular and cytogenetic characteristics of the cells that cause the disease. These molecular and genetic features give us some clues. Especially if there are targetable molecules present in the patient's leukemia cells, we use our rational drugs here, and as much as possible, we avoid standard chemotherapy and prefer more rational drugs with relatively fewer side effects. Especially in this patient group, the genetics, molecular genetics, and genetic characteristics of the leukemia cell are very important. And the question we always ask in acute leukemias is, do we have a molecule that can be targeted? Can we use such a drug, a rational drug? When we introduce these drugs, we try to stay away from standard chemotherapy as much as possible and focus more on treatment with rational drugs. At the same time, transplantation is an extremely important treatment modality. We perform allogeneic stem cell transplantation. In other words, we use cells taken from other individuals. But here as well, our main goal is to achieve high success rates in patients with rational drugs and to reduce the population undergoing transplantation as much as possible.